Finding Your Way with Ocular Melanoma, join me, host Tara McCannell, as I share with you everything I know about ocular melanoma. I hope you will learn, get your questions answered, and be motivated to empower your healing and to live your best life. Visit my resource page, sayhart.com/ocular melanoma. That's SEYHART.com/ocular melanoma for more content and support. There you will find my handbook for patients and families. You will find recordings of past episodes of this podcast. You will find recordings of live webinars that I've done over the past year, touching on topics such as a holistic approach to ocular melanoma, how to change your mindset for cancer survival, and how to do everything possible to keep your best vision. And regarding vision, I'd like to talk today about the worry behind losing the vision in the eye with the melanoma and this uncertainty that we have. And the reason I want to talk about this topic is because it comes up all the time. And it comes up in a lot of misunderstanding, lack of complete information about how eyes that have been treated with ocular melanoma do. And I want to step back and talk about retina specialists who help see patients with ocular melanoma. Why would you be seeing a retina specialist together with your ocular oncologist? The biggest there's several reasons, but one of the reasons is your ocular oncologist might not have retina training, and your ocular oncologist may partner with a retina specialist who either does retina surgery or who has skills in medical retina to help manage some of the side effects that can happen. For example, treating radiation retinopathy with injections. So sometimes you may be seeing a retina specialist together with your ocular oncologist. Another reason, certainly in my practice, because I am a retina specialist as well, is that a lot of times it is difficult for logistical reasons for patients to continue to see me on very frequent basis. So people may be coming from Hawaii or maybe they're in a different city. And so I always try to work together with a local retina specialist so that people don't have to be seeing me as frequently. However, I'm right here in case there are questions or concerns. And that is sort of the inspiration behind this particular episode about ideas that might be conveyed by a retina specialist that may not be true. So one thing that often happens is a retina specialist will start to get more involved when a person may need anti-VEGF injections. Anti-VEGF injections are the class of drug that help block the development of new blood vessels. Drugs in this class may be Avastin, otherwise known as bevacizumab, Eylea, otherwise known as aflibercept, Lucentis, otherwise known as ranibizumab, and there are others such as Vabysmo and Eylea HD, and there are others, to be sure, that will be coming down the line, drugs that have been created primarily to help treat wet age-related macular degeneration. Most of you don't have age-related macular degeneration, but fortunately, all the drugs that have been created for wet AMD, age-related macular degeneration, have a lot of benefit in some patients who are experiencing radiation side effect. So thank goodness we have access to all these different injections, these potential treatments. But the big question is, do you really need to be on these injections? So there have been already two prospective randomized trials that showed that by 2 years, your vision doesn't really change a whole lot. The OCT, the thickness that helps measure the objective retinal edema, doesn't really change a whole lot by 2 years. So do you need to be on these injections to save your sight? You don't. And it's very important to understand that yourself because most retina specialists who don't have a lot of experience in ocular oncology often think the opposite. Many patients have come to me and said, My retina specialist told me that I'm eventually going to lose all my vision and it's not too late and I need to get on these injections right away and not stop the injections at all or until we have some new treatment or some such thing. And we already know that the injections in the big picture don't make a significant difference. However, I do think that the injections are a great option because in the short term, they can be very beneficial, particularly when a person first starts to notice a little decline in because of radiation retinopathy. They may notice, it's just a little bit more blurred, it's a little bit more smudged. And usually the observation of this slight decline has happened very gradually. A person doesn't just wake up and notice that things are different. In radiation retinopathy, things happen very slowly. So it would be that most times, if I'm seeing a person at their 6 month visit, they might say, it's just a little bit not as great. It's sort of been that way for a few months. That is the typical presentation of radiation retinopathy. And it's not an emergency to start trying treatments. But if a person subjectively notices that their vision is a little bit less, why not try something? Because if radiation retinopathy, and this is the cause of leaking blood vessels that may be as a result of a side effect of the radiation treatment, if these leaking blood vessels are stopped and blocked by the medication given in the injections, a person might notice subjective benefit. And that's fantastic. If we can make your vision a little bit better, even if it might not be for the long run, but for the short run, I'm all in favor. And I encourage people to give these injections a try. And the other benefit is that these injections, these anti-VEGF shots, are actually very safe. We have age-related macular degeneration patients who have been getting literally hundreds of injections since the discovery of this treatment for macular degeneration. And we know that they're safe, they're well tolerated. Of course, it's a little inconvenient because oftentimes people come in every 1 or 2 months. But for macular degeneration, unlike radiation retinopathy, these are vision saving. Without these medicines, patients with macular degeneration will eventually lose their vision, develop scarring, and just lose everything in the center. And I remember seeing those patients way back before I even was practicing, before we had any of these incredible drugs. However, it is not the same if you have radiation retinopathy. Number one, radiation retinopathy is never an emergency. If it's diagnosed and then the doctors want to treat you with something, you can wait a few weeks. You don't have to have something on the spot. And the other thing is, you don't, you will not go blind if you don't get these injections. Your vision may get a little worse. And if you decide, I don't want to do anything, whatever happens to your vision is probably going to be what is going to happen to your vision, whether you have these injections or not. So the injections are fantastic because they may give you some subjective benefit and they are safe and we have them available. And these are all great things. But the take home message is that you will not, at the beginning of seeing some radiation retinopathy, you will not eventually lose all your vision. We so rarely see people whose vision is here and then it just slowly goes to nothing. That is the rare patient. The majority of patients who have some radiation retinopathy will drop a bit and then plateau. And maybe after a while, they may drop a little bit more, but the majority of people by 4, 5, 6 years tend to be pretty stable and we don't see a lot of change. Now, of course, there are the other ends of the spectrum. There are some people who lose their vision quickly after radiation treatment, but all this depends on the very unique characteristics of each patient. It depends where the melanoma is. It depends how big the melanoma is. It depends this amount of radiation. So when people say things like, oh, you're eventually going to go blind, just understand that they probably don't understand as much about ocular oncology as perhaps your ocular oncologist. But number two is that none of us can really predict what's going to happen to your vision in a year or 2 or 3 years. We have some probabilities, we have an idea based on all the experience we've seen, but it is pretty impossible to accurately predict what's going to happen to you eventually in the future. And that's one of the challenges that we have in ocular oncology and treating ocular melanoma is that not everybody follows what is supposed to happen in the textbooks. So, given that, there's a lot of possibility that you might not notice much change at all, or maybe your vision isn't going to have much change in 5 or 10 years. We just don't know. And I want to point out that we can have the same size melanoma in the same location in 5 different people, and everybody ends up different by 1 year, by 2 years, by 10 years. So we cannot predict with accuracy, but we have a lot of supportive treatments that can keep things good. So I feel that it's not really necessary to worry because we just don't know what might happen. The most important thing is that you get your care, you follow up closely with the ocular oncologist, you see a retina specialist, particularly if your ocular oncologist is not retina trained. You work with your doctors together, you ask questions. If one of your doctors says to you, you're probably going to go blind, it's not too late, let's see what we can do, you can say, just hold on, I want to understand about you're probably going to go blind. You have every right to pause your medical encounter and ask, what do you mean by this? What have you seen? And if these questions are being answered by someone who doesn't see a lot of ocular melanoma, or somebody who with less experience with ocular tumors is telling you these things, you must question the things that they're telling you, because what our doctors say to us, it influences us how we think. If the doctor says that we're probably going to lose everything and our vision's going to be blind, and or you might die from this and there's nothing we can do, those things affect us. So please pause, think about what has been said, and ask your doctor questions back. And then double check with your ocular oncologist. It's very important that you get questions answered and you just don't go with a flow of what everybody else is saying or doing, because chances are your doctors may not be correct, and chances are we don't know for sure. So I encourage you to understand this area as best you can, to ask questions of your doctor, especially if someone says something to you that is alarming, you've never heard before, or doesn't seem to make sense with what you may know already. And even if you if you have read about ocular melanoma and you understand, it's always a good idea to get other opinions, to find out. All this gathering information and asking questions and getting opinions is going to help you. It's going to empower you. You're going to do better the more you understand, and understand what you can do to help your vision, your eye health, to be preventive, and your overall health. Thank you so much.